Good afternoon. It's a pleasure to me to be here with you all. My name is Elisa Leão Teles, coming from Porto, Portugal, from the Reference Center of Inherent Metabolic Disease, Centro Hospitalar de São João. As you see, my talk will be dedicated to intra and intercenter coordination. This is my disclosure. And I must say that I'm a pediatrician that 35 years ago had the fantastic opportunity to create and found a unit in my service, the Inherent Metabolic Disease Unit, today a National Reference Center. I'm at this moment the senior consultant and coordinator of the multidisciplinary team and coordinator of the scientific and research area. And what I bring today with me is the lifelong experience and learning along the years, seeing, sharing, feeling, and what this was able to do to me. This is the plan of my talk. And we will start saying that it is 40 years ago that I met my first MPS patient. He was a little boy, 4 years old, hospitalized due to a severe pulmonary infection. And the suspicion, the clinical diagnosis was confirmed at enzymatic level. And I followed this patient until he says near the 14. And this was a very impressive experience to me, since that I have a scarce experience, and very especially for what I cannot do for the patients and for this family. And some years later, collaborating with Clara Samiranda, head of the specialized lab, we organized a meeting with a group of patients and families, with professionals, trying to create an association of patients with lysosomal storage disease. And this happened, and since now I'm working hard with all of them. As you know, MPS are a peculiar group of disease, genetic, rare, chronic, progressive, with a broad diversity of symptoms and morbidity, are an heterogeneous group of lysosomal disorders presenting at different age with different clinical presentations and progression rates. Some types have more multi-system involvement, others more bone disease, or others neurodegenerative progression disease. But all may have a severe impact in the 5 senses. And I must emphasize the diagnostic odyssey of this disease. This could be dramatic, and also the odyssey for obtaining supports. We all know that multiple clinical manifestations present different challenges for global and holistic management. And then along the years, we learn that the neurological involvement, the multi-system and other involvements cause incapacity and dysfunctionality interfering with daily life, with social life, with the physical and emotional dependence, with psychological impact, and with a decrease of quality of life. And we also learned that these diseases are challenging for the patients and family, causing consequences due to error or diagnostic delay, or delay of proper care, or inadequate preventive orientation, altogether causing personal family suffering with a decreased quality of life, as I said before. And this is a problem that must be seen at medical, political and social level, needing a very specific approach, namely with teams and centers that may ensure equal access to the treatment and better follow-up, better quality of care and support. And then we are talking about reference centers and how have been the implementation of these reference centers. And as you know, since last years of the previous century, rare disease have been considered a priority at the European level. It had been hard work of professionals, patient associations and legal entities, but only after a request from the European Commission in 2009, only after this, European member states adopt a plan or strategy to elaborate and implement national plans. The third European Commission of Experts in Rare Disease had then a very important work proposing quality criteria for centers of expertise or reference centers, and also proposing items for European reference network for rare disease. In Portugal, the National Plan for Rare Disease was approved in 2009, and the first recognized centers for rare disease and inherent metabolic disease happened in 2016. And these centers must have naturally very qualifications at clinical and scientific level. They must have appropriate capacity to diagnose, to advise and treat patients with evidence of the good results, with capacity to provide expert opinion on the diagnosis or confirmation of diagnosis and care, to produce and adhere to standards of clinical practice, and have a clear demonstration of a multidisciplinary approach. And at scientific level, they must have documented expertise, experience, competence documented through scientific activities, must have activities at teaching and training level with strong contribution to research, with close links and good collaboration with the patient associations. And I would like to share with you what happened in my center. As I told you, we have more than 36 years of experience accumulated. And I told you that you start in 85 with the creation of the inherent metabolic disease with a small team. The initial team was a small team, but with committed and enthusiastic professionals working hard to increase their knowledge and their experience. And the 90s brought a progressive increasing of the experience on the team, integrating professionals for different specialties, and altogether growing in competence and capacity for differentiated care with innovative therapies, and also in the teaching, training, and research area. And the new century brought new perspectives at the clinical experience with consolidation, and also at the teaching, training, and research level. We had the capacity to create the adult team, maintaining the same coordination, but very specifically in the area of MPS, this century brought important work with the integration of our center in the clinical trials, in the international working groups with new perspectives and early access of the patients to new therapies. And after, and in this last decade, our center was recognized as a national reference center, and after as a member of the national reference, European reference network, what give us new perspectives. Always you maintained a patient-centered care based on experience, on the research and collaborative work. And now the team has a differentiated composition with a central group, with a multidisciplinary and interdisciplinary team, with working hard with affiliated centers, with support of different service, with partners that works together with us as the specialized labs, with protocols, with different and specific health centers as a transplant unit, and working very close with the faculty and with the patient associations. And the team involving different specialized professionals at the central hospital and at the proximity centers has a central coordination and has a transdisciplinary work focusing the patient. This work is essential, and you may see here the number of professionals of the team highlighted in bold that usually are involved in the MPS patients' care. And the teams works closely with professionals from local centers and primary health centers, with community, with the patient associations, with a direct communication, trying to have a participated decision, aiming the best quality of life to our patients and maintaining guaranteed opportunities. And naturally, you have a close connection and collaboration with other reference centers at national level. As you can see, you have different centers at North, Center, and South, specialized labs with the national scientific societies and patient associations. And with all, we have harmonized interaction, maintaining clinical and translational research with national meetings, discussing problems and promoting solutions. And the same happen at European and international level, with close connections and collaboration with other European reference and other international centers. The integration in the European reference network brought new perspectives for the professionals and for the patient, with an easy access to the expert network with improved care. But at international level, also previously we had also participation in different clinical trials and multi-center studies, conducting at an early access to new therapies and working groups, as I said previously. And naturally, over the years regarding to MPS, our center has many work done in clinical and translational research at national and international level, having the possibility to contribute to better knowledge and better care. And then what is our experience at intra-center coordination. And talking about intra-center coordination, we must look to quality, focusing care on patients through his life, but also look for the teams, the resources, the process, the structures, the information, the training, with always with the reassessment of the results. We must optimize expertise and training. You must adjust the cost benefit. You must monitor the efficacy and safety of the drugs with a systematic and detailed characterization of clinical data. You must have information systems and health tools that allows connection and collaboration with maintaining support to interoperable electronic storage data. You need to have and use a disease codification. You use the ORFA code. To need facilitating the exchange of the knowledge and the provision of local care through digital health. You need to promote research and foster networking with rare disease registries and data collection. You must promoting the innovation with always reevaluation of results and annual planning. And also focusing the team. My special experience is focused on the coordination of the multidisciplinary, interdisciplinary, transdisciplinary teamwork, organizing the continuum of activities, placing the patient at the center, improving care and reducing patient burden. We must prepare best care conditions, discussing meetings, putting the problems and meeting and talking about the best solutions. You must have a critical evaluation of the internal procedures, the protocols of good clinical practice. You must maintain evaluation of clinical results and quality control. You must continue to improving networks activities and maintain how the others research activities, teaching, the formation, and the training. You must have also great work with creating information for the patients, performing activities to empower patients at different levels, and with the patient association support. You must have a good coordination between care and research activities. But, and in multidisciplinary team, it is particularly challenging the work, including other healthcare providers as specialized labs and others, continuing at local level with a structured working group. You must, and it is essential, adequate training for all health professionals. Is essential sharing best practice on diagnostic tools and medical care. It is important information, the training of patients, caregivers, and other stakeholders. You need to promote the home care. You need to have the support of palliative and continuous care, and you need optimized care with good integration in family, in school, at the professional and social level. And considering the patient, we focus our attention in promoting centered personalize timely care using the best technologies and the best treatment based on update knowledge and evidence, sharing and disseminating medical information and specialized social care, facilitating mobility of expertise, and naturally first improving and giving the best conditions, improving physical space, improving home health care, and looking to create a friend hospital. And we need also patient digital empowerment. And this is done also with the work in collaboration with the Patient Association, performing activities to empower patients at different levels, information, education, training, build the patient and families' capacity for management of medical and social aspects of disease, and also in supporting and collaborating with the Patient Association in their own activities, helping share knowledge and providing training to health professionals and others, helping to develop best practice research, overcoming the limit experience of some professionals, improving access to treatment, improving links and exchanges between professionals and patients. And you have also the tools that you use on a daily basis, and it is essential that they are properly evaluated over time according to the experience and the results. We have the international guidelines with monitoring and the usual assessment or management of specific situations, the biomarkers. You have also the standardized questionnaire that may give us an important information about the burden of the illness in MPS patients using the evaluation of subjective perception of the patient, the family, the caregivers. But it is also important to use specific patient report outcome measures that may allow early identification of difficulties, minimizing impact the problems with early intervention. And along the time, you must review all this with critical evaluation. And inter-center coordination will allow that the multidisciplinary team working with proximity centers and others may offer to the patient personalized care, considering the team and the patient as partners with a common goal that is define a networked care. And we must integrate patients and families as expert by experience. So inter-center coordination is essential, identifying problems, building solutions. And when you know that MPS are chronic disease and the patients need holistic support in diagnosis, must have a good transition of care, palliative care, improvement of treatment conditions, always with expecting new approaches, maintaining a translational research with a wider professional and patient training, with patient empowerment, with patients participating in their own decisions, with personalized and participative medicine. And then you are focused the inter-center coordination and our experience. Sorry. And talking about inter-center coordination, we have different stakeholders. We have the national regulators entities that provide the global orientation and that are linked to the Minister of Health, to the Minister of Science, Minister of Social Security and Work, and very especially to the Portuguese Government Health Authority that from where emanates the norms and the guidelines for the National Health Service. And after we have different items as research that are linked to a specific agency that support science, but also at the main laboratory of the Portuguese health system. We have the approval and evaluation of drugs linked to the National Authority of Medicine and Health Product. We have the problems with the reimbursement that is linked to Central Administration of Health System. And finally, we have the assessment of the work done at the reference centers with national coordinating commission of the reference centers. And you have also at national level a national coordinator commission for the treatment of lysosomal storage disorders. This commission integrates members of the regulatory entities that previously I presented, and also members of each reference center. And they must confirm the diagnosis of lysosomal disorders when a new case arises or treatment is proposed, must establish the parameters that may allow real benefits, creating adequate protocol for this purpose, must approval and treatment have the approval and treatment follow-up, establishing the minimum effective dose for each patient, and they must carry out a survey of the number of existing patients of national level. They must also ensure the monitoring and the evaluation of the treatment of lysosomal storage disorders, creating and maintaining a national register of patients. And this work is done. The members have several meetings along the year to discuss the patients' proposals to submit to the regulatory entities or procedures and others. And you have other partners, naturally, that work at different levels, networking, working groups, research, protocols, standard procedures, and they depend on the initiatives of reference centers, initiative for the scientific societies, from the patient associations, or for the industry and others, as well as you know, concerning network, the importance of the European reference network. And here I'm only including an example of initiative of our center. We organize yearly a meeting with, and we invite the professionals of the different reference centers, of the affiliated centers, and also for the proximity centers to discuss MPS. And last meeting that happened in 2019, we proposed a national critical review of our usual strategy to approach MPS patients, trying to implement new perspectives. But you have also other initiatives, and you have here other example of collaboration of the different stakeholders at national level. The FIND project is an initiative of the Portuguese Pediatric Society on Inherent Metabolic Disease and the National Institute of Health, promoting an early diagnosis of MPS patients, proposing the easy and free screening of the at-risk population using a single blood spot test. And then you can conclude that inter-center coordination is essential for, and you have many points to review. The registry and national data collection create potential for data integration for set of standardized and interoperable data, new diagnostic technology as thinking on newborn screening or specific national guidelines for risk population, or improving healthcare to home care at national level, or increasing research oriented to innovation with multiple interest parts on and based on a patient need, but it is needed financial support. Thinking on adequate funding for therapies and for centers, avoid undesired fragmentation or duplication of the resources with results evaluation, and thinking on dissemination of information to all possible types of media so as to reach all stakeholders, and finally review of the national plan and adaptation to new challenge. And what to ponder considering new perspectives? I think it is important that build bridge working all together with a collaborative work in synergy, no patients left behind. It is important to have a social and political evaluation for the menaces to solidarity, equity, and prioritization of this disease. It is necessary, it is needed that the patient have capacity and increase social culture. It is needed innovative research going to new treatments, new tools. You need supranational solutions with sustainability, commitment, and investment that promotes progress. Let me thank to the patients, to the families with whom I grew up during years, and also to the multidisciplinary team with whom I worked along the years, and thanks their commitment. And thank you very much for your attention. I'm leaving with you a photo of my city, Porto. Thank you.
Hello, thank you very much, Alisa. I think we have not any question. I'm looking for it here. We have no questions from the audience. So I have a question to you to comment. It's a general point of view. Yes, how difficult you find in the real world that coordination? What is your real impression in the real world? We are doing things, but how we can really know what is really happening, and then the major challenges in a summary.
Thank you so much for your presentation at the beginning, and now thank you for your question. Yes, it is not easy. It is a very difficult work that must be done. But I had luck to start many years ago, professional by professional, and at this moment it is more easier. But in my center, but as at inter-center coordination, it is very difficult. And it is a challenging process to have, even in the country, I'm not talking in the world, the global vision, even in the same country, you have many problems, and I think you must work. And I think also that the reference networks, that the international work must be done to have the same main objectives and the same point of work to be done. It is a very difficult, and I think that you must have many common points to work very closely to go ahead. It is a difficult work. I do not know what is, but I think your experience in Barcelona, in San João de Déu, is the same. And working at the clinical and at the same time looking for patients, for team, for the research that is needed, for the data collection that is fundamental, for the registries, for for all the new sources that you must have to make the best work that you need to present to the patients. And always you need to have the patients with us, with the capacity to go ahead, and as I said, as partners and participative and very empowered partners.
So I think the time is over. Thank you very much, Dr. Lisa Lau Teles from Porto.
Thank you, Dr.
Portugal.
Palau.
And we are finishing now this roundtable
Okay.
on the best practice in clinical management dissertation or lecture. So time is over, as I say. Thank you very much.
Thank you. Thanks a lot.
Bye.
Okay,
Bye.
bye. Bye.